My innovative video topic is about using artificial intelligence in refractive surgery. I am Dr. Abdelmonem Mohammed, Professor of Ophthalmology, Benha College of Medicine, Egypt. I am a former Fellow of Baylor College of Medicine, USA. Why we are talking about artificial intelligence nowadays? We are talking about artificial intelligence because we have a lot of data, so it is easier if the machine can resolve it like a calculator. Intelligence is expected to give ophthalmologists new automated tools for diagnosing and treating ocular diseases. What are artificial intelligence algorithms? The first artificial intelligence algorithm is simple automated detectors. It is the simplest form of artificial intelligence. The programmers give the software mathematical descriptors of the features to detect. The second artificial intelligence algorithm is basic machine learning. The scientists send to the machine a training set of images from affected and unaffected eyes. The algorithms examine the images to learn about the differences. The third artificial intelligence algorithm is advanced machine learning. It consists of one or two interconnected layers of small computing units called neurons. The fourth artificial intelligence algorithm is deep learning with convolutional neural networks (CNNs). The term deep learning means training the multiple interconnected layers, which comes closer to thinking. It is called black boxes. How can we get benefit from artificial intelligence in our daily life? We can do that by sending the data of the patient's topography to computer machine, then ask the machine to apply the algorithms, then print out the results. Application of artificial intelligence in the interpretation of the practical subjective score system 3 of corneal topography, instead of manual interpretation PS3 calculator. All we can do is entering the topography data for the right and left eyes to the PS3 calculator, as shown in the video. Then after pressing on the calculate button, we will see the screen that shows to us the normal corneal topography data, and beside it the entered data for right and left corneas of that patient, then beside them the green columns to show normal values of that corneas, the orange columns to show the values that have a moderate risk, and finally the red columns to show the high risk values of that patient. We can print out this datasheet to be attached to the patient's file. We can select the Inter-Eye Asymmetry button to get the score of each eye. In the end, the ophthalmologist can be guided to the type of refractive procedure that he can perform to that patient. The ophthalmologist can be guided to risky patients who are not suitable for refractive surgeries. This final datasheet can be printed out and attached to patient's file. Application of artificial intelligence in contour LASIK and astigmatism treatment protocols calculation. Like LIRA and TMR astigmatism treatment protocols. Alcon guidelines for refraction modification. How can we set the axis of modified cylinder? We set the modified axis to be the same value as the measured axis that is calculated from the raw topography data that exported from the Vario or oculizer machine to the Allegretto machine. How can we set the power of modified cylinder? If the power of clinical astigmatism is bigger than the power of the measured cylinder, enter the value of the power of measured astigmatism. If the power of clinical astigmatism is smaller than the power of the measured cylinder, enter the value of clinical astigmatism, plus of the difference between the power of clinical and power of measured astigmatism. How can we set the power of modified sphere? If the power of clinical astigmatism is bigger than the power of the measured cylinder, so, in cases of myopia, enter the power of the clinical sphere, plus half of the difference between the power of clinical cylinder and the power of the measured cylinder. However, in cases of hyperopia, enter the power of the clinical sphere, minus half of the difference between the power of the clinical and the power of the measured cylinder. If the power of clinical astigmatism is smaller than the power of the measured cylinder, so, in cases of myopia, enter the power of the clinical sphere minus quarter of the difference between the power of clinical cylinder and the power of the measured cylinder. However, in cases of hyperopia, enter the power of the clinical sphere plus quarter of the difference between the power of the clinical and the power of the measured cylinder. Final confirmation step, which is the spherical equivalent of the manifest refraction, must equal to the spherical equivalent of the modified refraction. Consider recommending wavefront optimization if any of the following conditions apply. 1. If the difference in power between clinical and measured cylinder is greater than 1.25 diopters. 2. If the clinical cylinder power equal to or bigger than 2.00 diopters and difference between refraction axis and measured axis is greater than 5 degrees 3. If the clinical cylinder power less than 2.00 diopters and difference between refraction axis and measured axis is greater than 10 degrees. Contour LASIK and Astigmatism Software Calculator. This video demonstrates the Contour software calculator. 1. In the first raw we can enter the manifest refraction sphere, cylinder, and axis. At the end of that raw the spherical equivalent of the manifest refraction is calculated. 2. In the second raw we can enter the measured cylinder and axis. 3. In the third raw the modified refraction sphere, cylinder, and axis is automatically calculated by the software according to the algorithms that have been used for programming this Contour software calculator. At the end of that raw the spherical equivalent of the modified refraction has been calculated that must equal to the spherical equivalent of the manifest refraction. 4. In the sixth raw high-order aberrations, we enter the value of C12 in microns. The software will convert it to diopters, and it will add this value to the modified sphere value in the fourth raw to be corrected by excimer laser. At the same time it will correct the patient refractive errors. If the differences between the manifest and the measured refraction exceeds the allowed values of the recommended rules, so the calculator will advise considering optimized ablation instead of topo-guided Contour ablation. All of these data can be printed out to be attached to the patient file to take-home message. We do need to understand how the nomograms work. However, it is not necessary to memorize the nomograms since intelligent machines can memorize them and compute their results. Thank you for your attention.